Hi, I'm Corinne and I'm a psychologist and I'm based in Brisbane, Australia, and I do have a private practice that where I actually treat my clients for a variety of psychological conditions. But what I wanted to specifically talk about in this video is about post-traumatic stress disorder, or PTSD as it's known. So the first thing I would like to bring up is that it is a very difficult, complicated condition to treat, and that's partly due to the type of condition it is and the symptoms that the person suffers from, but also from the fact that there's not a lot of people that quite understand what what to do in terms of what's involved in treatment and how to treat it effectively. So it's basically not quite well understood. So what I wanted to do in this video is to share the treatment methods that I've actually used, that I have found that has successfully treated my clients. But before I begin, what I wanted to do is explain first of all that any life-threatening situation, so that is a situation where you are placed in a very vulnerable situation where your life feels threatened, it can actually lead to post-traumatic stress disorder. Now, post-traumatic stress disorder cannot be diagnosed until 4 weeks from the event has passed. So prior to that, it is often diagnosed as acute stress disorder. But once the 4 weeks have passed, if the symptoms are still existing, then that would can be diagnosed as formally diagnosed as post-traumatic stress disorder. So the typical symptoms of post-traumatic stress are flashbacks and nightmares of the event. So when we're talking about a flashback, it's almost like a film strip of exactly what's happened. So it's in a lot of detail. So whenever you're experiencing a flashback, what it actually does, it brings you back into that same situation that you actually experience. So it's almost like you're reliving the situation. So one of the things that you have to understand with post-traumatic stress is that when you're first in the situation where you're having to deal with a real life-threatening situation, so that actual event that caused the post-traumatic stress disorder, when you're actually in that situation, your body actually prepares you to deal with the situation either by running away from the situation or fighting it. So the fight or flight. And it's designed to survive, for you to survive. So what happens is that during that event, your brain releases quite a lot of adrenaline. And that adrenaline during this situation is actually used. And while it's actually being used as fuel to get yourself out of that situation, because it's actually being used, it's not sitting in your system, and therefore during that event you're not experiencing the severe symptoms that you're probably experiencing after the event after the actual event. So when it's sitting in your system after, then all that adrenaline just sitting there, but it's actually not going anywhere, it's not being used because there's not a real life situation that follows. It's more of a reminder, or there's a trigger that reminds you of the event, which then forces you into a fight or flight situation, and your brain then thinks it's an actual real situation, so it prepares you to deal with it once again. And so it releases a lot of adrenaline. And when that adrenaline is actually released, if you've seen my other video on anxiety, it does actually causes all of these symptoms that you would typically get from an anxiety disorder or an anxiety attack. So what people tend to do is they want to avoid the triggers, because by avoiding the triggers, they think it's actually, well, it is helpful at the time to actually get you to avoid experiencing an anxiety attack. But unfortunately, the more you avoid situations that remind you of the life-threatening event, the more you're going to then develop depression, and then all of a sudden, by actually staying within your comfort zone and avoiding, when you're actually having to experience a situation that mimics or has those triggers, you're going to all of a sudden be, it's almost like flooding, and you're going to be suddenly exposed to that situation, and it's going to bring on an anxiety attack. So the typical thing that people suffering from post-traumatic stress will want to do is to avoid experiencing an anxiety attack. And the reason for that is because an anxiety attack puts you back into that vulnerable situation of not being in control. And so nobody wants to not feel in control or feeling extremely vulnerable, and also experiencing those symptoms, because they can be very, very frightening, because the palpitations, the heart rate, the blood pressure going up, dizzy spells, and feeling nauseous, all of those symptoms of an anxiety attack are not pleasant. They actually make you feel like you're not in control of your own body at that time. And so that's what people typically want to avoid. Now, for some people, to avoid, sometimes, to avoid experiencing nightmares, what they will actually do is rely on alcohol or drugs, just to go and be able to manage and cope. But unfortunately, all they're doing is existing in life. They're not really living, because they're not able to do the things that they probably did and were able to do before the accident or the life-threatening situation. So one of the things that the first part when it comes to treating post-traumatic stress, it's about first understanding what that person's going through, because a lot of the times anxiety can actually be manifested as anger, and that can be misinterpreted by family members and relatives, because obviously it impacts on them. But that anger sometimes comes from that build-up of adrenaline. So if, say for example, you're wanting the family member who's suffering from anxiety, from post-traumatic stress, you're wanting them to maybe go to a party, they may not be able to do that, because they know that by going and attending that party, it's just going to bring on an anxiety attack. So they might refuse. They might then might lead to a conflict, and then they sort of get angry, because the fear of having to go and experience an anxiety attack builds up, and that's when they're not, they might come across very aggressive, and that can actually then often affect relationships as well. So it's not just flashbacks that sufferers have to experience. There's nightmares as well. So those flashbacks that make the sufferer go back into experiencing the same negative things that they've experienced during the event will also experience that in a nightmare. So they'll be reliving, and there's a difference between having a memory of what's happened and having a flashback. So flashback and a nightmare, you are actually as though you're back there again, and whatever you've been experiencing, you experienced during that time, you're re-experiencing over and over and over again. And that can be extremely exhausting for sufferers. So what they often do is rely on alcohol to sedate, to relax, to avoid, and often they can also use quite a lot of distraction. So you'll see them being extremely busy to try and keep their mind off anything that reminds them of the event. So when it comes to treatment, the first part of treatment is understanding what's going on in your body, the anxiety attacks, starting to understand that when you're experiencing an anxiety attack, it is a normal response that every human being and every animal has built, and it's just a defense mechanism to help you to survive. So it's not, those symptoms are not harmful. While they might make you feel uncomfortable, they're not actually harmful. They're actually a normal response for a normal, life-threatening, real situation. So the problem we have is that when you are fearful of having an anxiety attack, and this is why I recommend going and having a look at my video on anxiety and how to manage it, and what treatment, because that is a part of addressing post-traumatic stress. It's part of the treatment plan. So, and I'm not going to go through this in this video, But so once you actually experience an anxiety attack, if you can actually understand it, and if you can actually no longer fear having anxiety attacks, and if you know how to control it, then what's going to happen is that you're going to start to build that high sense of control that you really need, that has actually been distorted as a result of the life-threatening trauma. So when you experience a life-threatening situation, what happens is that your sense of control goes right down and your sense of vulnerability goes right up. So when you're feeling very vulnerable, your guard stays up. And when your guard stays up, it means that you're telling your body, your brain, that you need to have a constant flow of adrenaline because you're on the alert and you actually need to protect yourself. So what your brain will do is release a lot of adrenaline, and that will actually keep you very tense and very heightened, very hypervigilant, and it's also going to make you experience these symptoms of anxiety that are not very comfortable at all. So what the first part of treatment, and often I hear about desensitization, systematic desensitization as a form of treatment. While that might work, it works in the latest stage of the treatment plan. You really need to address the anxiety first, because the more we talk about the situation that's caused you to develop post-traumatic stress, the more you're going to end up feeling uncomfortable. You're going to be experiencing anxiety attacks in sessions. So the first thing you're going to be doing is attaching a negative association with therapy. So you're going to do everything you can to try and avoid, because it's uncomfortable, because as soon as you walk into that room, you are going to be experiencing anxiety attacks, knowing that we are going to be talking about the life-threatening situation. So I would usually, with my clients, I'll talk about that when they're actually in a better place and more comfortable to talk about it, but I won't be desensitizing from the beginning of therapy, because sometimes you can actually get a client used to talking about a life-threatening situation, but that doesn't mean to say they're treated. All they've actually done is learn to be able to say what's happened in detail without experiencing any emotion, but you're not really treating the PTSD. So one of the things that I do is I address the anxiety first, so that once they understand about anxiety, they can manage the anxiety. Then what happens is that they won't no longer fear anxiety. So that will actually give them more sense of control. That will increase that sense of control and decrease that sense of vulnerability. Once that's established, the second phase of treatment is about actually putting into perspective the risk. So, for example, if a client has been assaulted in the workplace, often what can happen is that the workplace, the type of job, the location can often be perceived by the sufferer as life-threatening, so a risk. And one of the things that you want to do is to be able to isolate the risk factor. And by isolating the risk factor, we're talking about what exactly is the threatening part. Is it the workplace that you've worked for X number of years without any problem? Is it the location? Is it or is it the person, the client that has assaulted you? So once you've isolated the factor, the risk factor, to being the client, then you can actually start to feel more comfortable knowing that, okay, well, the workplace is supportive, the workplace is non-threatening, and neither is the location, and neither is the job. So now it's about sort of like working out exactly what do you have to do to feel safe. Like if that person is still in the workplace as a client, what do you want to do? What boundaries can you set to protect yourself from this person? So if it might even be just discussing that with your manager about not having to work with this client, and it might even be that you no longer want to work in that for that organisation, but you might want to work for another organisation where that client no longer works or as a client, but then at the same time, you want to be able to learn from what has put you into that risky situation. Like, what are the contributing factors that, where, could it be, was it because of the type of client that, did you not know the history of the client that assaulted you? Is it the lack of resources and having been on your own at that time? So once you actually work out exactly what could have been done to prevent, then that's the formula that you want to introduce. Now, for combat post-traumatic stress sufferers, a lot of the times, during the war, you are in a vulnerable situation regardless, the environment, everything is high risk and your guard is up all the time. But when you come back, apart from the flashbacks, nightmares, which obviously that's the second part to address in the treatment, it's about also understanding that you are home, you're in a safe environment, there is no risk, apart from actually trying to deal with the memories that are obviously haunting you. By addressing those in therapy, that's the only thing that you would need to start working more on. Once you've actually come to terms with the fact that, okay, I'm safe now, I'm not at war, my guard can drop down, I don't have any enemies, I don't have to go and fight for my life, I don't have to try and survive. So the only risk that you're having to deal with now that you're at home is how to manage the anxiety attacks that are brought on by the flashbacks and the nightmares. So, and again, that is something that has to be addressed in therapy. Unfortunately, it's not an easy thing to deal on your own. So anxiety medication is something that is often prescribed, and there has been some research indicating that the combination of therapy and anxiety medication can help in accelerating the treatment and effective recovery. So, that's something you might want to talk to your GP, because sometimes post-traumatic stress, when you avoid life to avoid post-traumatic stress symptoms, then what happens is that you're cutting out your life, you're not living, you're basically existing, and that can develop into depression. So it's often depression, although it's a secondary condition, the primary condition is post-traumatic stress. So you really, really want to have medication. If you're going to go down that path, is the medication needs to address anxiety, not so much the depression. And often there might be an antidepressant that does both, but that's something you need to discuss with your GP to see what's going to be the most suitable medication for you. But by going to telling your GP that you're wanting to specifically address anxiety, he or she will know exactly what medication will suit you. So once now with regards to the nightmares, often the flashbacks contribute to the nightmares. So a nightmare will happen when your mind is so focused on the traumatic situation. So if my guard is up all the time and I'm always looking out and trying to protect myself, and I've got constant reminders of the life-threatening situation, then when I go to sleep, my subconscious mind will actually start to, bring out all of these daily conscious thoughts into a nightmare. So that's why sometimes people will actually often wake up, with a nightmare. And usually the nightmares, if the person feels like that's actually mimics exactly the situation they had to deal with, then they will actually wake up experiencing an anxiety attack. So again, it's the anxiety attacks that have to be addressed. The other part of it is putting into perspective the ratio of vulnerability and control. So once you actually manage your anxiety attacks, the next stage is to talk about the event, the life-threatening event, so that we can pick it to bits and sort of go, okay, exactly which part do you feel you do not have control, which part do you still feel is risky, so that we can actually put it down, put it back into perspective. And by doing that, what we're doing is we're reducing that sense of vulnerability. What we're doing is reducing that and increasing that sense of control, so that you're actually feeling more in control. The more in control you are, the more you're going to not experience anxiety attacks, and the more you're not going to be so frightened and not needing to be on guard. So that means that you're relaxing around no matter what situation you're in, and that's one of the things that will actually help with post-traumatic stress, the treatment of post-traumatic stress, and reducing that the experiences of anxiety attacks. So once you've actually done that, it's about sort of like monitoring the and it will actually slowly desensitize. Your nightmares will actually reduce, your flashbacks will reduce over time, and they will reduce not only in frequency but in intensity. And so once that happens, as it reduces, your sense of control will increase. So your guard won't need to be up anymore. You'll start to be more relaxed. Your brain will release relaxing, happy, feel-good hormones rather than adrenaline, so you won't feel as tense and you won't have a need to have to avoid situations. So I hope that's been helpful. Please, I'm happy to discuss any or answer any questions. If you want to message me, I do have a Facebook page called Heal Your Mind, Heal Your Life. There is a butterfly that is a symbol, so if you're wanting to message me and ask me any questions, please feel free to do that. I have also some videos up on anxiety and also on depression. There's a short one on anxiety, and there's a much more longer, much more involved one on anxiety as well. So if you go to my YouTube channel, you'll actually be able to access those videos. I also have a book, but unfortunately it's not a book for anxiety. It is a book mainly for addressing depression, and it's probably would actually be more useful for people suffering from self-esteem issues and depression, but not necessarily post-traumatic stress. It is called Heal Your Mind, Heal Your Life. It is also on my YouTube channel. I talk about the book in detail on that. So thank you very much for listening. I hope it's been helpful, and I'll see you soon.